My name is Mario Cesar Garza. Local San Antonio artist, born and raised in San Antonio, grew up on the east side of town. Um, Art's been part of my life since I've probably been 5 or 6 years old. I grew up in a family where there was a lot of art. I had an older brother who was also involved in art, studied art, went on to teach art. My younger brothers kind of followed. So we were a family of artists. Um, we had art studios at a young age, so we had all of our supplies there for us to paint and draw. So it's been a kind of a family thing for us. Um, we still paint, all of us do. We're still together, we're very close. All of us brothers live in San Antonio. So, very much were involved in different types of art. I grew up in a house where our parents allowed us to be open and be free and free thinking. So there was a lot of music, a lot of art. We went to Catholic school growing up, so that was something that also kind of inspired us in the fact that in the '60s, it was a lot of church involvement, and growing up in a very parochial kind of school, you kind of follow regulations. But one thing that stood out was the Renaissance art. So as a very young person, I found out about Michelangelo, and so the whole story about his Sistine Chapel and how he did it, and the Last Judgment, and so those are inspirations. And as we got later on in life, as I grew up and got into music, and it was more about pop and contemporary music, you start to look at art differently. And so it wasn't so much just the Renaissance art that we were familiar with going to a Catholic school. All of a sudden, where my eyes are open to more of the abstract movement and more of the pop art movement of the '60s and the abstract movement of the '40s. So now you start investigating and start looking at a lot of different styles of art, a lot of genres of art. But it all, it's really something that we all did. I continued it through my years. I'm also a musician, so I also performed with bands and played guitar. So that was fun to do as well. But I traveled through Europe at 18, and I backpacked, for a couple of years. And so I got to see a lot of the museums firsthand. I got to go to the Louvre. I got to go to the Vatican. I got to go to the National Gallery in London. So, all of a sudden I'm seeing this artwork for the first time live. And so all that kind of touched me. But a visual artist, that's really kind of my style. I work with acrylics mainly. I do some watercolor. I use a lot of charcoal, pastel, to just pencil sketching. And that's what you got here. It's just mainly sketches and drawings. So again, the art has been in my life all, to today. I'm still doing it, still love it, and will continue doing this. We started to hear, kind of got the rumblings that, hey, there's a pandemic out there. This is February, March. I started paying real close attention to what was going on. Having children myself, you're kind of concerned, okay, what are we doing? And you're hearing a lot of what needed to be done to protect ourselves. I didn't really know the severity of it. It was still early, but I started to get, more and more information. And being that I'm married to a healthcare worker myself, a lot of that information started coming through to me and filtering to me, and I would filter it out to my kids and and my grandkids to make sure that they were aware. But it really affected me. It became a real surreal kind of moment for me. All of a sudden, our normal routine was stopped. I couldn't see my kids. Everybody was quarantined. The whole city shut down. So all of a sudden, we stopped, and it made me kind of think about, okay, what can I do? What am I going to be able to do? What message can I do? There was a lot of, I guess we were getting misinformation. People were told, no, you can go outside. No, you can't go outside. Masks were hard to come by. You couldn't get basic goods at the store that you just needed. We were stockpiling. I mean, it was a scary moment for a lot of people. So I started doing some paintings that showed a kind of a concern, so that people could really get real about it. I was doing these pieces where I would involve some Renaissance painting, some pop art painting, just because that was just my idea, my interpretation. Things that I enjoyed looking at, and I love that type of art genre. I incorporated it in works, and with a spin of of COVID and the need to wear a mask. I was trying to convey some hope and some seriousness for people to get the idea to quarantine, stay home, wear a mask, all these things. That's really kind of what was in my head. It was, I'm going to make a message to the people. And my work is about messaging. My work is about showing emotion, but hopefully somebody will understand it and will get it, and it would work. It would make somebody feel like, okay, I get this. He's right. I'm going to do this. My kids were also someone that I was trying to get the message out. So that was geared to them as well. In July, when things really got bad, where the numbers were increasing daily, I'd listen to the mayor, and my wife would come home. I was very worried for her safety. I didn't understand the protocols at the hospital. But as time went on, I started to feel more comfortable about the hospital protocols, the safety of the nurse staff and the healthcare workers, how the hospitals were. The hospital was taking care of their needs in terms of protection. My wife is a director on a floor there at Sky 10. All of a sudden, her whole entire floor was COVID. So she was there. She was surrounded by nurses who were dealing with it on a day-to-day basis. I felt like, how can I help these people? What can I do to show my appreciation for being on the front line? Because they're risking their lives, basically. I mean, they were in it's a very, very scary notion to think, I got to go to work, I got to do a job, perform a task. But there's a chance I could get COVID on top of that. Thankfully, there was enough protocols and the systems that were utilized that, the whole staff came out great. No one got sick. Everybody worked together. But it was that I guess that leadership, and my wife was a big part of that. Is she would just have meetings, and she would be there to provide the help and the guidance. It was a war zone, and it was not just on her floor. There was other floors. So you had the emergency rooms. You had the different floors. They were dealing with it. So I think, it was about 60 or 70% all COVID at that time. This idea of, okay, I'm going to do a drawing, came up. I did a drawing of Fauci, Dr. Fauci, and I put it on Facebook because I wanted people to say, hey, listen to the scientists. And then I did a drawing of Jonas Salk, because I know he came up with the polio vaccine. And growing up in the 60s, we all dealt with that and vaccinations for polio. And that was such a big thing. I remember my mom being so thankful for that, because we had someone in our family with polio. So I thought, let's get the word out. I'm gonna put this, I did this really nice rendition of Fauci. I put it out there, listen to the scientists. And it got me thinking about, these people are out there working, these nurse staff, these healthcare workers. What am I going to do to give them something, to thank them for the work that they're doing? So I asked my wife, I said, do you have any photos of your staff? And she said, yes. I said, send them to me. And she started sending them. It kind of trickled in every day, a few at a time. And she would tell her staff, hey, my husband wants to draw you as a thank you. He wants to give you a drawing. He does art. So I came up, I did 1, 2, 3, 4. Next thing you know, I've got 54, drawings here. And with that whole premise of, hey, let them know that I'm thinking of them and I'm thanking them. And I'm going to give them a piece of my work just to say thank you. And that's how this whole Sky 10 idea came through. One of the things about artists, we're fine being in the studio all day. We're probably the most, quarantined group of people you could ever find. I mean, we're good with being alone. That's what we do. I go in my studio 8 o'clock. I get out of my studio 5:30. Sometimes I go back in, 7 o'clock. So I'm fortunate that my studio's at home, so I can get in there anytime. But it was the whole idea that we are now in a situation where everybody is quarantined. Everybody needs to be thinking about social distancing and wearing a mask and washing hands. It opened my mind to some creative thoughts and ideas. Early when the pandemic started, there was this unknown about, okay, well, am I going to get it? Can I, is my wife going to come home and bring it in? What's going to happen? So I took every day as a gift, almost like, okay, today I'm going to do some work, and I'm just going to let loose, and it really helped me to kind of cope with the stresses that my wife was coming home with and going through the worriness of what was happening there. So it just let me be as free as I could be in terms of what I wanted to do. There was no more, I'm going to paint a still life of some fruit, or I'm going to do an abstract painting. And now I wanted to get this message out. So I was just like consumed with art that was COVID related. What can I do? So it just allowed me to be open and free. I did quite a few paintings showing anguish of the nurse staff, because, hey, you guys are out there going about your day. These nurses are there, and they are having to deal with a lot of people coming in who are not doing well, who some of them died, and they can't bring in their family, and now they have to deal with this all day long. It freed me. It was an eye opener for me. Still is. I still have a lot of fresh ideas that I want to continue. I still have more of these to do, because this isn't all of them. There's about 110 of the nurse staff on Sky 10. And my goal is to do all of them, is to do every one of them and give it to them. So that's my hope, and I probably will be able to do this probably by the end of November. I should have everything complete and can hand these out. The inspiration again is really everything that I learned as a kid growing up. It's all the different styles and genres of art that I appreciated as a kid. I mentioned Renaissance art, and I mentioned some of the classics. I just kind of took and borrowed and used and kind of made an interpretation of, because they're so iconic. I wanted to utilize that iconic view of art in a way that brings out kind of safety measures and ideas about COVID, and the fear of people. And I did a painting of the Last Judgment, where Michelangelo's Last Judgment of Jesus with his hand up, and then you have surrounding, you have the lower part of the painting is everybody going into hell, right? And the fear in their eyes, and then you got the sky above, and you got heaven up there. And so I wanted people to say, hey, this is a scary time, but you need to understand how important this is. So I'm using these ideas kind of blended, mixed in, to kind of show uh, the the classic work mixed in with some of my own style of work, um, it's more of a pop art style, just to see where that takes me. So that's kind of where I'm at with that. A lot of color, very, very splashy. Well, first of all, I gotta say, I want to thank them. I want to thank them really, and because when a lot of these nurses, some of these nurses just started. This is their first gig. This is their first job. They're fresh out of college, and they came in, not knowing that that their first job is going to be dealing with COVID. Um, a lot of them are very senior. A lot of them have been around for a long time. So, um, my inspiration really was them. It was their uh, ability to go in, say, hey, I'm dealing with this. Is what I signed up for. I'm gonna do the best I can, and also the hospital, university hospital as well, because they were like instrumental in making sure that they had the equipment, they had the PPE, they were prepared for this onslaught. So that was really kind of the whole idea, the whole premise. The stories that I've heard were people going in, just being, selfless and passionate about everybody that was coming in on board. The people that were leaving the hospital, once they were able to leave, how you gave them a parade down the hallway where you had nurse staff and hospital staff down the hallway congratulating them and clapping as they left. People would leave, people would come. That floor was never empty. They were making room for people. People were waiting in the wings to get in. It was that bad. So yeah, were they scared? Definitely. Was there tears? Yes. Was there frustration? Absolutely. I heard the stories, but they persevered. And I think as a team, I think my wife was very instrumental to make sure that people felt like there was a purpose. She really made sure that she made them feel that they cared, that the hospital staff cared, that the leadership of the hospital cared. So, if you can just imagine, or maybe you can't, but COVID is a very hard thing to deal with. It's not going anywhere. As a matter of fact, it could be getting even worse as we get into winter. But we still have to be aware. They're still going to be there. They're going to do their job regardless. Hopefully they won't work as hard, and it's not going to be as bad. But all of them are heroes. That's all I got to say. They're all heroes, and I thank them for their work. We couldn't do it without them. Yeah, I want to thank Ruth and Malena and Centro Cultural Aztlan for just being able to help me and put this exhibit together, this installation together. I saw the work. It was on my table laying there. I never dreamed it would look like this once it's all together. So I want to thank them, thank the university health system of the hospital for allowing me to do these drawings, and hopefully I'll be able to pass those along to them pretty soon. That's my goal and my dream, and that's going to happen for sure.